Ontario hospitals are in desperate need of funding, asking the Ford government for another $1 billion in order to meet the demands of an aging and growing population. It is money critics say should be rerouted from private clinics to the public hospital system. Ontario's health minister appeared at a funding announcement Wednesday morning at a private fertility clinic. The Ford government giving $250 million to 25 clinics to shorten wait lists for fertility services. On the same day, the Ontario Hospital Association put out a statement stating the full revenue needs of the hospital sector will not be fully met this year. Is there funding that can be reallocated from anywhere like private clinics that the government has funded to instead go to the Ontario Hospital Association?
You know, you look at this clinic that we're standing in today, and is this something that needs to happen in a hospital setting? They can have these services outside of the hospital system to make sure that our hospital is actually ready and prepared for the acute patients that we need to have available.
The Ontario Hospital Association says the key cost drivers are population growth, aging, and inflation of wages and supplies.
We're ultimately still $1 billion in need.
That's on top of the $1.1 billion the government had already allocated for hospitals in the spring budget.
It is a lot of money. And I think the challenge is that it's complicated.
There's a $1 billion gap right now, they say.
Well, there's a $1 billion gap that the OHA is talking about. What I am saying is we have been actively working with all of our individual hospital partners. They have submitted plans to show us how they are going to get a path to balance.
But the Ontario Liberals say with no additional funding, balancing hospital budgets will be an uphill battle.
This is the theme. Give an impossible task, watch it fail, and then take it over.
The Liberals say the government has directed hospitals to submit detailed governance information, which they describe as an unusual demand.
This is how it all started with school boards. Again, pushing a system into deficits and then questioning those that are providing the oversight.
In response, a spokesperson for the health minister tells us the fear-mongering claims of the Liberals are baseless and irresponsible. For City News, I'm Tina Yazdani.